You might think that aging is the main reason for memory decline. But no. Sometimes the real culprit behind it is the very medication you are taking every day. Sudden memory loss in older adults is not just about aging or illnesses. As many of us often assume, one extremely common but often overlooked cause is the side effects of familiar medications. Some types of medicine, whether prescribed or bought over the counter, can harm the brain, impair cognitive functions, and even speed up the progression of diseases like Alzheimer's by several times. What is even more concerning is that many of us are taking these medications daily without realizing the risks. In today's video, I am going to reveal 10 types of medications that older adults should avoid to protect their memory and mental clarity. I will not just list the names of these drugs, I will also explain why they are dangerous, how they silently affect your brain, and most importantly, safer alternatives you can proactively discuss with your doctor. This is crucial information that can help you protect your own health and potentially change the lives of your parents, loved ones, and everyone you care about. Before we dive in, I invite you to leave a comment below as a positive affirmation for your brain health, something like, "I stay sharp and clear-minded every single day," or any wish you want to send into the universe. And do not forget to like the video and subscribe to the channel so you will not miss any valuable tips to live a healthier, sharper life every day. Now let us talk about the 10 types of medications older adults should avoid to protect their memory. 1. Benzodiazepine sedatives. As we age, getting a good night's sleep becomes more difficult, and feelings of anxiety tend to surface more easily. Many people turn to benzodiazepine sedatives as a lifesaver to sleep better and relax. But few realize that behind the calming effects, benzodiazepines are quietly sabotaging their memory in ways they might not notice until it is too late. Benzodiazepines work by slowing down the activity of the central nervous system, making us feel calmer and sleepier. However, this same effect also impairs our ability to memorize, process information, and form new memories. In older adults whose brains are already more sensitive and vulnerable, this impact becomes even stronger and more dangerous. Many credible studies have shown that long-term use of benzodiazepines is linked to a high risk of cognitive decline, and it may even accelerate the development of Alzheimer's disease. Some reports reveal that after just a few months of consistent use, older adults might start experiencing noticeable issues with short-term memory, missing appointments, mixing up family members' names, or even getting lost in familiar neighborhoods. Even more worrying, this condition usually progresses silently. Users and their families often dismiss the signs, thinking they are just normal aging, without realizing the true root cause is the medication they are taking each night. 2. Statin cholesterol-lowering drugs. To understand this better, let us start with a basic truth. The brain contains an extremely high amount of cholesterol, and this fat is not just the bad guy. Many people think it is. Cholesterol is a critical building block for nerve cell membranes and supports the transmission of nerve impulses, all essential for memory, thinking, and information processing. When you use statins to lower your cholesterol levels, not only does blood cholesterol drop, but cholesterol levels in the central nervous system can also be affected. Excessive reduction or imbalance can weaken the structure of nerve cells and make signal transmission within the brain less efficient, leading to memory issues. It is important to note that not everyone who takes statins will experience this problem, and the cardiovascular benefits of statins often far outweigh the potential risks, especially for those at high risk. However, older adults, particularly those with sensitive nervous systems or a history of neurological conditions, need to be monitored closely while on statins. 3. Tricyclic antidepressants. Medications like amitriptyline, nortriptyline, and imipramine belong to the group called tricyclic antidepressants. They work by adjusting neurotransmitters such as serotonin and norepinephrine in the brain. Although this sounds positive, tricyclic antidepressants come with a long list of side effects, and memory impairment is one of the biggest concerns. The reason lies in their strong impact on the cholinergic system, a critical part of the nervous system related to learning and memory. When this system is suppressed, the ability to form new memories decreases significantly, and recalling stored memories becomes much harder. In older adults where cholinergic function naturally weakens over time, this impact is even more pronounced. Several studies have shown that long-term use of tricyclic antidepressants can lead to brain fog, confusion, and even symptoms resembling dementia. What is frightening is that the early signs are often very subtle, forgetting conversations that just happened, getting lost in familiar neighborhoods, or being unable to recall activities from a few minutes ago. These symptoms are often mistaken as normal for aging, while in reality, the medication is a significant part of the cause. It does not stop there. Tricyclic antidepressants can also cause excessive drowsiness, orthostatic hypertension, which is a drop in blood pressure when standing up, and an increased risk of falls, all of which can indirectly worsen cognitive decline in older adults. 4. Beta blockers. As we age, cardiovascular diseases such as hypertension, arrhythmias, and heart failure become more common. Beta blockers like atenolol, metoprolol, and propranolol have become standard treatments to control heart rate and reduce heart strain. These names are likely familiar to many older adults. However, alongside their undeniable benefits for heart health, beta blockers are now being studied as a potential risk factor for memory decline in seniors. Beta blockers work by suppressing the effects of adrenaline, the stress hormone, thus slowing the heart rate and lowering blood pressure. However, adrenaline also plays a critical role in strengthening memory and the brain's reflexes. When adrenaline levels are overly suppressed, memory formation and neural responses can slow down, leading to issues like difficulty concentrating, quick forgetting, or even confusion. Besides their direct impact on memory, beta blockers can cause excessive fatigue, mild depression, and sleep disturbances, all factors that can indirectly worsen cognitive function. It is important to emphasize that not everyone who takes beta blockers will experience memory problems. The effect depends on the dosage, duration of use, individual sensitivity, and overall health condition. Nevertheless, staying alert and proactively monitoring for any unusual memory issues while using beta blockers is crucial, especially for those over 65 years old. 5. Opioid painkillers. Pain relief is a very real need for older adults. Lingering dull aches from arthritis, sciatica, or post-injury pain can make daily life heavier and harder than ever. In such situations, opioid painkillers appear like a lifeline, providing near-instant comfort. However, behind that feeling of lightness, many people do not realize they are also sacrificing something precious, the sharpness of their mind. It does not take years of use. Even after a short period, some older adults begin noticing changes in their ability to process information. They may react more slowly, struggle to recall simple things, or feel mentally foggy each day. This is not just a natural part of aging, as many mistakenly believe. The underlying reason for these changes lies in the way opioids disrupt the natural balance of neurotransmitters in the brain, especially dopamine and gamma-aminobutyric acid. These two chemicals are crucial for maintaining alertness, motivation, and flexible thinking. When these systems are thrown off balance, memory may stop functioning properly, and precious memories can start to fade away without the person even realizing it. Another important point: opioids do not just directly affect the brain, but also indirectly damage memory by disrupting sleep patterns. Deep sleep, the crucial stage where the brain repairs itself and strengthens memories, is often impaired. As a result, the ability to recall information and recover mental clarity diminishes significantly. That is why many people after some time on these medications start feeling like they are not themselves anymore, a state easily mistaken for depression or neurological disorders. 6. Parkinson's disease medications. Parkinson's disease, with its tremors, muscle stiffness, and slowed movements, is a heavy burden for older adults. Medications like levodopa, carbidopa, and dopamine agonists are seen as the light at the end of the tunnel, helping many patients regain mobility and reclaim some independence in their lives. Yet ironically, while the body becomes more flexible, the mind, the true treasure of aging faces a hidden threat. The problem does not lie in controlling movement symptoms themselves, but rather in how these medications affect the body's overall dopamine system, including the brain. Dopamine does more than just control movement. It is deeply involved in emotions, memory, and decision-making. When dopamine levels in the brain are overly adjusted, even unintentionally, this delicate balance can be disturbed, leading to serious consequences. Some patients, after using these medications for a while, may start experiencing cognitive impairments, struggling to plan activities, facing mood swings, and losing control over impulsive behavior. In more severe cases, hallucinations and mild delusions may occur, clear signs of brain dysfunction. This is particularly concerning in older adults, whose brains are already more sensitive and less capable of self-regulation. Unfortunately, these changes are often not recognized early enough. 7 anti-seizure medications. There is no denying that these medications have saved lives and greatly improved the quality of life for many people living with epilepsy. They work by stabilizing electrical signals in the central nervous system, preventing the abnormal surges that cause seizures. However, the cost of this stability is not insignificant. The central nervous system thrives on flexibility and sharp information processing. When nerve signals are overly suppressed by medication, communication between brain cells slows down. In older adults whose brains are no longer as flexible as in their youth, this intervention more easily leads to consequences: difficulty learning new information, slower thinking speed, and a gradual loss of sharpness in communication and thought. It is also worth noting that medications like carbamazepine can cause hyponatremia or low sodium levels in the blood. This is another dangerous factor that increases the risk of confusion and disorientation, especially when patients are also taking diuretics or blood pressure medications. This does not mean that older adults should refuse epilepsy treatment. On the contrary, controlling the underlying condition is crucial for preventing serious consequences like falls or traumatic brain injuries. However, careful choice of medication dosage adjustments and close monitoring for even the slightest changes in cognition and alertness are absolutely essential. 8. First-generation antihistamines. This group of antihistamines does more than just block the histamine receptors that cause allergy symptoms. They also have profound effects on the central nervous system, particularly by strongly suppressing the cholinergic system. This system is responsible for coordinating memory learning ability and alertness. When the cholinergic system is blocked by medication, memory is disrupted, learning new information becomes harder, and thinking speed slows down significantly. In younger individuals, the body can often compensate and recover quickly. But in older adults, where brain function has naturally declined over time, this suppression carries heavier consequences: frequent forgetfulness, information mix-ups, and trouble focusing even on simple daily activities. Even more concerning, many older adults use first-generation antihistamines out of habit, popping a pill every night to sleep better, or taking one whenever they feel itchy, without realizing that their brains are gradually losing their natural agility. One little-known fact: side effects of first-generation antihistamines also include daytime drowsiness, dizziness, and slower reflexes, all of which increase the risk of falls, one of the leading causes of injury and faster cognitive decline in older adults. This does not mean that antihistamines are inherently dangerous. The real issue lies in uncontrolled use, lack of careful monitoring, and choosing the wrong generation of drugs. Today, newer antihistamines like loratadine and cetirizine have been developed with major advantages. They barely cross into the brain, significantly reducing the negative impact on memory. 9. Anticholinergic drugs. If we had to name one group of medications that quietly but severely threatens memory in old age, anticholinergic drugs would definitely be on that list. Although patients rarely pay attention to them, these medications are found in many familiar prescriptions, from treatments for urinary incontinence and asthma to Parkinson's disease, allergy medications, and antidepressants. The real danger lies in their effect on the cholinergic system, the part of the nervous system responsible for learning memory and maintaining alertness. When cholinergic receptors are blocked, the brain is essentially cut off, making the processes of receiving, storing, and retrieving information sluggish and disorganized. In younger individuals, the body can somewhat compensate for this disruption. However, in older adults, where natural acetylcholine levels have already declined with age, further suppression only speeds up the memory loss process. This explains why, after just a short time on anticholinergic medications, many older patients start experiencing noticeable changes: frequent forgetfulness, confusion, and disorientation, even in familiar settings. A particularly alarming fact is that the level of danger does not correlate directly with immediate dosage. It accumulates over time. Taking a few pills may not cause an issue, but long-term use, even at low doses, can significantly harm memory. Credible studies have warned that prolonged use of anticholinergic medications greatly increases the risk of developing dementia and may even accelerate the progression of Alzheimer's disease in people who are already at risk. What makes this even trickier is that the variety of anticholinergic drugs is extremely wide. Someone might be taking medication for an overactive bladder, adding in a regular antihistamine, and then a mild antidepressant, unknowingly stacking anticholinergic effects from multiple sources. 10. Proton pump inhibitors. Mechanically speaking, proton pump inhibitors work by reducing the amount of acid produced in the stomach, thereby protecting the stomach lining from damage. However, recent research has pointed out that long-term use of these medications can carry an unexpected consequence: an increased risk of memory loss and cognitive decline in older adults. One hypothesis scientists have proposed is that proton pump inhibitors may reduce the absorption of vitamin B12, an essential nutrient for healthy nerve function. Prolonged vitamin B12 deficiency damages nerve fibers and slows down signal transmission in the brain, which explains why long-term users of proton pump inhibitors may experience memory lapses, forgetfulness, and even mild confusion. But it does not stop there. Proton pump inhibitors are also believed to potentially influence amyloid levels in the brain. Amyloid being a type of protein whose abnormal buildup is closely linked to Alzheimer's disease. Several large-scale studies have shown that people who use proton pump inhibitors for extended periods have a higher risk of cognitive disorders compared to those who do not. The concerning part is that these effects usually creep in silently without obvious warning signs. Patients might simply notice themselves forgetting familiar names, struggling to find the right words during conversations, or taking longer to complete simple tasks. Signs that are easily brushed off as just normal aging, without realizing that the medication might be playing a role. The very pills we trust to protect our health can sometimes carry hidden effects, especially when it comes to memory, a priceless treasure for every individual. With statins, for example, the cardiovascular benefits are undeniable. But alongside those benefits, carefully monitoring cognitive function and spotting even subtle changes in memory is crucial, particularly in older adults. Taking care of health in old age is not just about keeping the heart beating steadily or maintaining stable blood pressure. It is about safeguarding clarity and alertness as well. That way, every passing day retains its meaning and every moment lived remains vibrant and full. Before we end today's video, if you resonate with this message, please leave a comment below as a pledge to your brain health. Something like, "I cherish and protect my memory every single day," or any other positive affirmation you wish to share. And do not forget to like the video and subscribe to the channel so you will not miss out on more valuable tips to help you and your loved ones live healthier, sharper lives. Let us build a community together, a community where aging means not only a strong body, but also a mind that stays bright and clear with every thought and every smile.